Today, we're focused on the Arlington safety net. We're focused on what's been happening in the last few years. Our guide is a very talented woman, Anne Vor der Bruegge. She's currently the director for grants and initiatives at the Arlington Community Foundation, which she joined in 2014 to lead collaborative efforts between Arlington's nonprofits and local government. She's leading the foundation's Bridges Out of Poverty and Shared Prosperity economic mobility initiatives. She also convenes Safety Net Arlington, human service nonprofit leaders working with government to strengthen our community's response. Anne, the floor is all yours. We look forward to your presentation.
Thank you so much. And hello, everyone. Again, I'm Anne Vor der Bruegge, and I'm really very happy to be with you today. Good afternoon. Thanks for having me. And I realize that you're not all from Arlington. And while my focus today is about the Arlington nonprofit sector, which Chris just mentioned, much of what I'm going to describe in terms of community needs and approaches to meeting those needs by the nonprofit is no doubt applicable to the broader region. So I'm going to now share my screen to move into a PowerPoint. There, is everyone?
Yes, looks good.
Able to see? Okay, terrific. So just a quick overview of what I plan to cover today. I'm going to talk about why do we need a safety net in Arlington of all places. I'll describe some of the key players in Arlington's safety net, talking about the strengths and special features of the safety net nonprofits. At the end, I'm going to share with you a very intense collaborative initiative that the nonprofits have been working on with the foundation as well as Arlington County over the last several years called Bridges Out of Poverty. And there will be some opportunity as I talk today for me to introduce or reference how the safety net nonprofits have specifically responded to the pandemic. The work of the safety net is informed through both statistics and stories and relationships. So I'm going to be using both today. And we will take breaks about every 20 minutes. So if you have comments or questions, I'd love to hear them. Just real quick, why is the Arlington Community Foundation in this space and what is our role here? The foundation was founded about 30 years ago, and we have 4 primary functions. First of all, we are a philanthropy hub. We provide individuals and organizations a reliable way to get their charitable gifts and their legacies to vetted nonprofits that serve important community needs. We make grants to nonprofits, and we're the largest private provider of scholarships in Arlington. We also act as a convener. A significant investment of our resources and staff time goes toward our leadership role in the community as a convener of the nonprofits and other organizations so we can maximize impact in our work on the public-private spectrum. We convene, as Chris said, a group called Safety Net Arlington, which is a directors peer group of the nonprofit service providers, and they meet regularly to discuss advocacy issues and emerging needs and to share the challenges they face as the leaders of the nonprofits in a safe and constructive space. And then finally, we run programs. The 2 that are most relevant in our largest programmatic initiatives are Bridges Out of Poverty and Shared Prosperity, both of which address economic mobility. And I will be getting to those in a bit. So just in summary, the Community Foundation strives to strengthen our local nonprofits, to encourage a better understanding of the needs of Arlingtonians, and to address some of the most critical issues of our time to ensure that our community provides opportunity for everyone. So just so we're on the same page in terms of what we mean by safety net, what I'm referring to are the 501c3s, who are the direct providers of the most basic necessities for a stable life. Housing and shelter, health, mental health, food, childcare, emergency funds, employment assistance, and so on. And again, as Chris shared earlier, the reality is that in nearly every American community, nonprofits fill critical service gaps, and they supplement often under-resourced local government programs. And we all know from our life experience that any of us at one time or another can find ourselves vulnerable. It could be the loss of a job or a catastrophic accident, an abusive partner, or a fall into illness or addiction that brings any of us into an unstable place where we need experienced and compassionate care. And then add to that the high cost of living in Arlington. That means that many of our residents are just one setback away from instability, or they've already fallen through the cracks and they live in constant crisis mode. So Arlington is consistently ranked first or second in the state for best schools and being the healthiest community in the state. And nationally, we're always ranked near the top or at the top for best place to start a restaurant, the fittest community, the best digital community, the best cities for college grads. And once we were even third for one of the most hippest locations in the US. We're continuously among the top for the highest median income. But it's really important to understand that a significant chunk of people in Arlington are not experiencing our prosperity. When I say AMI, I am referencing the annual median income. In Arlington in 2020, the annual median income for a family of 4 was $126,000. The group that we're focused on as a safety net are those living below 30% of this AMI. So that's $37,800 for a family of 4. Can you live on that? Just imagine. We have 28,000 individuals or 10,000 households living at this level of income in Arlington. Our highest poverty zip code is 22204 in South Arlington. And our highest poverty neighborhood is the Columbia Heights neighborhood, or also known as Arlington Mills sometimes. It's bounded by Carlin Springs Road and Columbia Pike. And there, 29% of the residents are below the federal poverty level, which is even lower. It's $26,000 for a household of 4. Next week, you're going to hear a much more in-depth presentation from Sonia and Tricia about the disparities across Arlington from one neighborhood to the next. I'm just giving you a quick flavor here. Our highest free and reduced lunch school has 81% of the students on free and reduced lunch. And of course, we have other schools with 1%. So while these statistics are sobering, individual stories really help illustrate how precarious living in poverty can be. Here's an example. One woman's apartment window was broken by a baseball from a child in the neighborhood playing. She was confronted by a property manager with a $32 repair fee. And she was so frantic about not wanting to be evicted that she desperately handed over that $32. That was her weekly bus fare to work. So then she had to look for a ride to work, which made her late. So her manager docked her 2 shifts. At that point, having lost 2 shifts, she could no longer pay her babysitter, which meant she lost her job, and that brought her to the real possibility of eviction. And there's even more to this story. The fine print on the notice that was given to her to pay the fee gave her 30 days to pay it. But she was so caught up in the grip of that moment, facing that property inspector with his uniform on. Brain science shows us that toxic stress of living in crisis mode with no emergency funds limits our ability to maintain focus and slow down and take the long view to make a plan. And also those of us with a family legacy of economic security and community connections, we can recover from these crises far better than a household or a person coming from generational poverty. A broken window and an unexpected $32 charge plays out very differently for someone in the middle class than for someone who's poor. So who are these 28,000 individuals? As I said, these are the folks making under 30% of our AMI. And we have 10,000 households in Arlington that are in this situation. We know that the living costs in Arlington are 3 times that for a family of 4. Arlington's vision statement says that we are a caring and inclusive community. And the county defines equity as all Arlingtonians having the resources to experience optimal well-being and realize their full potential. So we have a shared value or a moral mandate of protecting the well-being of all of our residents. But there's an economic inclusion mandate as well. These 28,000 low-income individuals represent 12% of Arlington's population, and they're at high risk of being displaced. And while high wage jobs comprise a significant share of the county's economic growth, workers in these lower wage jobs form the backbone of our economy. We're talking about our essential workers, childcare workers, hospital aides, office cleaners, construction and food service employees. They're a vital part of our economic success and our diverse community fabric. We also have people on fixed incomes, such as aging baby boomers and disabled individuals and veterans among those living in poverty in Arlington. These essential workers are being priced out by market-driven pressures, including some of the highest childcare expenses in the country. And the Northern Virginia Community Foundation recently put out a report showing that our region has the highest housing cost burden for low-income residents in the nation. So from an economic health standpoint, no one wins if these workers have to commute long hours to get here because living in or near Arlington is unaffordable. Our friends at the Virginia Hospital Center pointed out that people who moved out to Manassas, because it's less expensive, pass 2 or 3 hospitals on their commute into Arlington, and those hospitals are hiring. So driving into work into Arlington to the Virginia Hospital Center is a difficult equation for people, and it makes it hard for the hospital to keep these essential positions filled. So some would say that we're at a critical or even risky juncture here in Arlington as we try to balance inclusivity with economic growth. People in poverty rely on a combination of the income they earn, the public benefits they get, and the community safety net supports to survive. When any of these resources are unpredictable, our low-income neighbors have to choose which necessities to do without. And of course, we know that inconsistent access to food or medical care or safe housing or childcare has detrimental effects on their health and their well-being, as well as their children's. In our work with the Arlington Safety Net, we at the Community Foundation wanted to put this tension of surviving in Arlington on a low income in graphic relief based on up-to-date data. So last winter, we worked with the Urban Institute in Arlington County to model the calculus involved in surviving in this really expensive community on a low income and the impact of the very steep benefits cliff as people try to earn their way to self-sufficiency. So by cliff effect, I'm talking about the fact that low-income workers face a devastating and sudden cutoff in their public assistance, things like Medicaid and food stamps, childcare, and housing subsidies, when they have even a minor rise in their earnings. So the potential loss of the benefits mean the worker has to refuse her raise or a better paying job, or not accept his promotion to avoid having their family worse off. The result of our modeling effort is a very short video that you're about to see. It takes us through the scenario of Sandra, a single Arlington mom with 2 children, ages 10 months and 4 years old. And hers represents a very typical situation among Arlington's working poor. So as you watch the video, think about what will happen if Sandra gets a broken window.
I grew up here in Arlington. When I was in high school, I had to drop out to help my parents with the rent. Now I'm on my own. I'm a single mom with a 10-month-old and a 4-year-old. I work full-time making $10 an hour, and I don't have any other source of income. I qualify for public assistance, which helps with our housing, childcare, food, and medical insurance. After I cover transportation, clothes, personal care, and household supplies, I'm left with less than $400 each month to pay off my loans, my cell phone, and do things like take the kids out for ice cream. What if I get a flat tire or get sick and miss days of work? I want to get out of poverty for my kids. Watch what happens as I begin to earn more. The horizontal axis in this graph shows my income as it increases. The vertical axis shows my spending power after I pay for our basics. The red line is where I make just enough to make ends meet at the end of every month. You can see that after I got a raise from $7.25 to $10 per hour last month, I have a little more to spend each month. I need to keep going to move forward. Let's say I manage to increase my income to $15 an hour in the next couple of years. I'm now making just over $31,000. I lose my food stamps and my Medicaid, and my childcare copays go way up. It turns out to be one step forward, many steps back. Now I know what they mean by falling off the cliff. I'm $725 short for just covering the basics every month. Getting extra food at the food bank and donated school supplies and clothing from churches helps, but it's not enough. Should I even take this leap? Should I move away? Where could I go? I grew up here and my parents still need my help. My son loves his school. As my salary increases even higher, my childcare and housing benefits disappear at a quicker rate. I managed to get my GED and several promotions. At $20 an hour, I'm making over $41,000. I've doubled what I earn. But I'm even deeper in the hole. Do I take a second job? Who will keep the kids at night? I'd never be home for them. Should I rent out my second bedroom? Then I risk losing my rental assistance. At $30 an hour, I'm making $62,000. I no longer qualify for housing assistance, and I need to cover rent and utilities. My youngest is still in before and after care at school, but I only get a very small discount. My spending power is negative $227 each month, less than when I made $10 an hour cleaning offices. I've tripled my salary, but I still need help just to get by. Something as simple as a flat tire can still push me over the edge. My kids are in middle and high school now. I'm making $35 an hour, over $72,000. I'm finally self-sufficient, paying off my debts and starting to save for my retirement and college for the kids. But how am I going to get from $10 an hour to $35 an hour? Let's work together to bridge this gap.
Back to you, Anne.
All right. So I'd like to hear your reactions to this video or to anything I've said so far. Any questions you have? Do you know any residents that are in this circumstances, and what's your reaction?
Jeff, how are we doing questions? Should people raise their hands or?
They can feel free to jump in, or they can send a question via chat. They can unmute themselves, or they can raise their hand. Any of the above. We do have one comment, very eye-opening. I had no idea. I second that. It kind of blows me away that that it takes so much that so much is lost as one makes increases their income. I had no idea. We do have one question. What impact, if any, would raising the minimum wage help fill the gap?
A great deal. I mean, I'm not an economist, but I know it's a really lively debate right now about raising the minimum wage. But another way to do it is through what we call voluntary living wage payments. So individual employers or large corporations can commit to living wages. The airport here in this area is on a path for that, for its baggage claim workers and its the folks working in all the concessions and so forth. So that's really critical, very critical. We know cash in hand is critical, and we've seen that with the pandemic in particular. Someone asks about undocumented workers. That's really important to be aware of. Many of virtually all of these public benefits are not available to folks that are not documented. Some benefits can flow to a family in what we call a mixed status household. So if the children were born here, the families can get a partial housing grant or a partial childcare subsidy. I should say childcare subsidies are not dependent on documentation because the children, those resources do flow to the children. But there's a great deal of fear, and I don't think we have a good handle on how many undocumented. It's a difficult thing to get our clear data on, but those of us who've been working in this space for years know that it's a significant number of our residents, and they're an important part of our community. So there's a lot of nonprofits that actually fill that gap and are able to be a bit more flexible about getting services to them.
And somebody asked if we could share the video, a link to the video, which I just put in the chat. And then we also got a question, are there any increases in the thresholds for Medicaid, food and food stamps when we increase the minimum wage?
That's a really good question. I don't know that. I know that, Virginia, of course, about Medicaid expansion, and I think there's some discussion about raising that bar even higher. They did just this last week in Virginia raise the level of income for being eligible for childcare subsidies. But I don't know the relationship between what that would look like in terms of any minimum wage adjustments.
And based on the timing that you set forth, we should continue with the slides now. It's about 12:30. Okay,
well, I don't want to frustrate anyone. Are there any other questions or burning thoughts?
None in the chat.
Okay, Yeah, I have to say that I've worked with vulnerable populations in DC and Arlington for over 3 decades, and I've really seen the toll that the cliff effect takes up close. But there was something about very arduously plotting this graph with the help of Arlington County's eligibility specialists and Urban Institute's Tax Policy Institute, looking at the effects of the earned income tax on Sandra's life and the child care tax credit. This exercise hit me in a whole new way. And the numbers definitely line up with MIT's living wage calculator tool and other ways of calculating this. The numbers all line up. So anyone who actually is working in a nonprofit or a community organization who's sat down with people that are living in these circumstances can tell you this is very real. So hopefully this shows you some of the extreme compromises that people on low wages have to make to live here. And it helps make the case for why we need a strong safety net. I will go into sharing screen again.
I'll just add that I hope at some point in this presentation, you invite us as students and as Arlingtonians and give us some advice on how we can get involved. And
Sure.
Good.
I do have a discussion guide that goes along with the cliff effect video. We really do want it to be something widely shared and used in our community to educate folks or inspire folks. It is so technical in terms of the documentation behind it and the calculations, but I do have a discussion guide that gets to some of that, Jeff, in terms of what are some things going on, what are some solutions that might create cushion in terms of policy and things like that. So I can make that available too.
Before we continue, are there any questions? I don't have any, but just giving one last chance. Anybody who wants to speak up? Okay.
Okay, so I understand you can see the screen, is that correct?
Mm-hmm.
Yes.
Yes.
All right. So the good news is that here in Arlington, we do have a strong set of safety net organizations. So here are some key players in our safety net. There are others as well. This is not, an exhaustive list. And I'm not going to read through this whole page. You can see that I've categorized the nonprofits by sort of the topic of need that they address. But one thing that's important to point out is the differentiation within a certain group. So for example, shelter, you see 3 organizations listed, and within that group, each organization differentiates the scope of what they do and the population they serve. So for example, ASPAN shelters homeless individual adults, Bridges to Independence shelters families, and Doorways shelters women and children who have experienced domestic violence and trauma. One thing that's unique about Arlington as compared to other jurisdictions is that our county's human services are all housed under one integrated department. And I take this for granted until I start working with another community and see how chopped up everything can get. But within Arlington, all the human services are integrated under one roof. So that's public health, financial support, case management, housing subsidies, the whole range of public assistance, mental health services, substance use services, job training and placement, child welfare, and basically the whole range of basic needs. The county, or the Department of Human Services, is the anchor of our public-private safety net system. In any given year, there are 56,000 walk-in visits to the customer service center, which is that first doorway that visitors to DHS walk through to find what they need. These nonprofits multiply their impact with each other they multiply their impact through collaborating with each other and in partnership with the county. And each organization focuses on what it does best while ensuring that their clients access additional services that they might need from other organizations. So for example, the free clinic gives its patients a checklist of non-medical supports that they'll need, including a referral for supplemental food to the Arlington Food Assistance Center, or AFAC. And another example is ASPAN's partnership with the county and Virginia Hospital Center. When our homeless residents are being released from the hospital with an acute medical issue, they can recover in the county's Homeless Services Center in medical respite rooms, which the hospital provides, and an ASPAN nurse practitioner is there to attend them. What I have here are some select organizations and their volume of individuals or households or units that they provide. This is for FY20. I say at the top meeting needs, but they all want you to know that the demand continues to be higher than the supply. So most of the organizations have a waiting list. AFAC, or Arlington Food Assistance Center, provides over 14,000 individuals with supplemental groceries. And by the way, this is for FY20. AHC and APA provide affordable rental units for families and individuals. Arlington Thrive acts as a conduit for getting charitable and local and federal government funds into the hands of residents who need emergency rent relief. And then the free clinic provides both primary and specialized medical care to low-income uninsured residents. Nonprofits are really good at responding to emerging needs as they arise. They've been in the community, some of them 25, even 50 or more years, and they have a deep collective knowledge of the community's needs. They draw on their experience to anticipate change and respond to it. So now's a good time for me to mention, give you a look at some of the needs and volume of clients served through this period of our pandemic. I have on this table 3 organizations: AFAC, Arlington Thrive, and Arlington Free Clinic, and I've got 3 fiscal years. So FY19 was the last fiscal year we had before the pandemic hit. The fiscal years I'm referring to are July through June. And then you can see in FY20, the numbers jump, and FY20, the last 3 months, which was March through June, was at the very beginning of the pandemic. And then the last column is FY21, first half only, which we're in now, which is full on pandemic. And you can see that both AFAC and Thrive have seen an exponential increase in demand for their supplemental groceries and rent relief. And you can also see that the free clinic has continued to carry a high caseload. But it's also important to understand that given the pandemic, they can't hold their lottery, which is an in-person process for bringing in new patients. It's a lottery process that involves standing in line and waiting in the waiting area. And so for obvious reasons, that cannot be done right now. But nonetheless, Arlington Free Clinic has maintained a very high caseload. And they have switched to telehealth for all of for most of their services. And just a word on Arlington County's safety net response during the pandemic. Walk-in visits to the county's customer service center have halted temporarily, but the call volume to its customer service center has increased exponentially by tens of thousands. And likewise, the number of people on Medicaid has increased exponentially. In between July 2019 through December 2020, so basically 18 months, the county has put $8 million in emergency rent relief to 2,600 low-income households through Arlington Thrive to get into the hands of the residents and landlords who need this. Much of this money has come from the Federal CARES Act dollars. So beyond just increases in numbers as a result of the pandemic, the nonprofits starting last March to step up in whole new ways and go outside of their usual lines of business. Many of the nonprofits who aren't normally in the business of food relief have purchased significant grocery gift cards so that their clients can get the food they want, the choice. It's wonderful that there are the opportunity to get supplemental groceries from AFAC and to get food from food pantries that many of the faith communities and PTAs have popped up. But what we have seen over the course of this pandemic is that families long for the chance to go to the grocery store and get what they want for their children, what's culturally appropriate and what their preferences are. So this model of getting grocery gift cards out has been sort of the go-to gap filler. And the Community Foundation and Arlington County were able to partner to put significant funds into this model of grocery gift cards. The free clinic, as I said, has had to temporarily switch to primarily telehealth. And many of their patients, as you can imagine, struggle with technology access. So getting people onto the computer and into their appointments takes a great deal of support on behalf of the free clinic staff. And also, given the protracted nature of the financial crisis, the county has been very flexible by extending the length of time that people can get emergency rent relief, and they've raised the caps on the amounts that individual households can receive. And Thrive, in addition to getting incredible numbers of checks into the hands of residents for rent relief, they've staffed up to help the county with the call-in center as people are calling in and needing help and needing a crisis assistance for rent and everything else, unemployment and so on. Thrive's staff during this pandemic has been able to assist with that function. And of course, the county has stood up and is leading the testing and vaccine efforts. So just moving away from my sidebar about the pandemic, another example of ways that nonprofits are continually evolving to meet emerging needs is an example involving doorways for women and families. Back in 2016, Doorways sounded the alarm about the growing number of homeless youth that we were seeing in our shelters and or who are just couch surfing from one place to the next, and the lack of supports that are available to them. So Doorways responded to this by adding in and building out a developmentally appropriate program for 18 to 25-year-olds experiencing homelessness. Nonprofits fill gaps. I want to speak to our most pressing gap and the role that the safety net plays. Affordable housing is the most critical aspect of a community's livability. It's a ground zero of need. I don't know if Jay Facette is on today. He's going to be one of your speakers in the future, and he was on last week, but I'm pretty sure he called it our moral imperative, the moral imperative of Arlington, or something to that effect. Jay, if you're here, you can correct me. The squeeze on affordable housing compounds other stressors in individuals' lives and for the community as a whole. As I've shared with you, there are currently 10,000 Arlington households living at or below 30% AMI, and of those 10,000, 8,000 of them are renters. A recent analysis shows that there are only 1,353 rental units in the county affordable to those 8,000 rental households. So I'm going to show you this chart, and don't panic. I'll walk you through the salient parts of what you need to focus on here, and I'm hoping it will show you what I'm getting at. This is a very recently done housing needs analysis that the county commissioned from GMU's Stephen Fuller Institute. So this bar on the left shows the units, the number of apartments affordable at any given income level. The bar on the right are the renter households, not individuals, at that level. So can you follow me? Is this making sense? I'm not hearing anything, but I'm hoping it does. So on the far left, you see at the lowest affordability level, that's this blue at the bottom, are the number of units, and I said there's about 1,300 of them affordable at 30% AMI, but here are the 8,000 households at that level. If you go next bar up, it's the 30 to 49% AMI. Again, many more households living at that level than there are apartments available to them. The band that's at 50 to 59% AMI is fairly balanced in terms of units available in renter households. But here's where things get really interesting. When you get to the 60 to 79% level, this gold bar, there are double the amount of rental units needed than there are renters. And at the next level up, 80 to 99%, there are triple the amount of apartments available for those that are in that category. So what's happening is that people in the lowest income levels are having to live in units priced to be affordable for people making twice as much. Or just as bad, they have to choose to put multiple households crowded into a small apartment. Both the county and the nonprofits have critical safety net roles in addressing this gap. On the county's part, the Affordable Housing Investment Fund, which we call AHIF, has helped to create the majority of Arlington's committed affordable rental units. The revolving fund is financed through general revenue, developer contributions, and repayments of the prior AHIF loans. And the AHIF dollars help nonprofit housing developers like APA and AHC and Wesley Housing leverage additional loans from private banks and investors. But there's still a huge shortage of deeply affordable housing units. That's where the county's housing grants and eviction prevention efforts come in to fill some of this gap. Arlington County provides monthly housing grants to 1,400 low-income households to bring their rent down to a level of affordability. And as I described earlier, the county also provides significant funding for temporary emergency rent relief when people are facing eviction, and that money is distributed by Thrive. But again, let's be clear that the supply gap is huge still when it comes to deeply affordable housing units and subsidies. So more on the important features of the safety net nonprofits. The safety net nonprofits bring a level of trust with community members, and they meet people where they are, both figuratively and literally. They're based in the community and in the neighborhood, so they can reach and form relationships with people who might be more isolated. The grapevine is a really powerful tool that works in their favor. And with the trust that they build, the nonprofits can also encourage residents to take advantage of the county's many offerings. And then conversely, when individuals go to the county offices, that they can be referred to the nonprofits for services that best fit that given person's needs. So there's a complementary relationship between the county and the nonprofits. This reciprocity and the focus on building trust is especially helpful in recent times. We know that our local government is ultimately responsible for both the census and the vaccine rollout, but the county relies on our nonprofits to be trusted messengers, to reduce the hesitancy they may have in the community around filling out the census, and now to register for the vaccine. And as we were talking about earlier, there are undocumented persons who've left difficult circumstances in their home countries and are now part of our community, in our schools, in our workforce, in our neighborhoods. And as a safety net, we continually look for ways to meet their needs and to address the language and legal barriers and fear that they face in accessing government resources. The county really values this role that the nonprofits can play, and it's evidenced in their funding of the Legal Aid Justice Center and Just Neighbors, two nonprofits that help our immigrant residents. So I want to switch into a story. Another example of the transformative power of trust that's built over time through long-term relationships in the community. This is about a gentleman named Sam that I've gotten to know as an ASPAN volunteer over the years. Sam is a very gentle man. He's educated, and he shared with me that he came here from Sierra Leone and worked at that Coca-Cola factory off of Seminary Road for years until he was laid off and lost his way. He spent 6 years sleeping on the ground behind an office building on Fairfax Drive. And this whole time he was maintained this dignified and caring countenance. He was afraid to live in the shelter, but ASPAN's outreach workers and case managers spent years building trust with Sam, and they were able to move him into his own apartment a couple of years ago. And they were able to recoup the pension that Sam had never received from his job. So he now tithes a part of that pension to his church, and he stops by to chat on his long walks around Arlington. I haven't seen him since the pandemic, and I hope he's doing okay. I believe that you all received a link to a report that we produced at the foundation about 5 years ago on Arlington's safety net nonprofits. And one of the central themes of that is the degree to which the nonprofits are able to be cost effective and creative in the way that they provide high quality services is through the way they leverage donated goods, donated services, volunteers, and the way they can attract corporate, philanthropic, and public funds. So there's some rather technical information in that report. And while it's out of date, given that it's 5 years old, it gives you the idea of the kinds of contributions of revenues and so forth that the nonprofits make. Another strength of the nonprofits is that they elevate dialogue. Their primary responsibility, of course, or focus is direct service to the residents, but the safety nets also contribute their voices as advocates for sound policy and community priorities. Since they have a front row seat as witnesses to the needs in our community, they can also discuss and elevate how that translates into needed reforms at the local, state, and national level. An example of this is Offender Aid and Restoration, or OAR. OAR provides intensive services to men and women before and after they're released from jail. And they use what they witnessed to shine a light on the systemic racism that's behind mass incarceration and other inequities in our society. Over the last several years, OAR has offered substantial community education through its powerful anti-racist and racial justice curriculum for different cohorts of community members. I hope that some of you, I actually know that some of you have participated in these, and I highly recommend it. Another example is APA, or Arlington Partnership for Affordable Housing. They formed some years ago the Community Progress Network to bring the voice of low-income residents to the forefront. They offer dinner and dialogue around issues that matter to them. And most of the nonprofits also contribute their time as leaders and participants in broader public-private initiatives, such as Arlington's Affordable Childcare Initiative, the Destination 2027 work on equity, affordable housing advocacy, and as I mentioned previously, to support the census and vaccine efforts. So now I'm going to break again for questions or comments on how do you see these nonprofits show up in your community, or if you're not from Arlington, how does this resonate with what you see in terms of services and gaps in yours?
I do have a few questions that came in during the talk. So if we could take those while others are forming their other questions.
Okay.
One of them is, well, let's go to the first one first. One of them is, can anyone get, or better put, what are the requirements for someone to get food from the food center in Arlington?
You're talking about the Arlington Food Assistance Center?
Yes.
So they have a really thoughtful model. They, first of all, their AFAC is very clear. They are supplemental groceries. So they're not, they don't pretend to be the only solution food-wise for an individual household. People need food stamps, they need the supplemental groceries and other resources as well. And what AFAC does is it relies on a couple of key partners to vet the households and refer them, so that once someone comes to AFAC to become a regular and to receive food, AFAC can count on the fact that these households are vetted as truly in need, they're Arlington residents, and that there are eyes on them. There are eyes in the community on them, because if you need food from AFAC, you probably have a lot of other needs or some other needs. So the idea is that the county social workers or the free clinic and even some of the folks in the schools are set up to be able to refer households to AFAC. So once they show up at AFAC, they are already vetted and known to be both in need, to be Arlington residents, and that they're also getting supports from these other organizations. But AFAC is very low barrier. If someone shows up, my understanding is if someone just shows up, they can always get something, but to continually come back, they use the system that I just described.
What role do churches and other faith-based organizations play in the?
Yeah, I'm glad you mentioned that. A very important role. I mean, many people trust the faith communities more than anything, and it's a natural and an important connection for the faith community and the residents who come to them for this help. So it's a very important role. We've seen a lot of faith communities really step up during the pandemic and providing all kinds of resources for households.
Yeah, I also, when I was working at a nonprofit like the Kiwanis Club and other organizations like that, they were also participating.
Absolutely, yep.
Here's a question for homeless people. How do the groups get the word out about resources? Not many homeless are plugged into social networks.
Well, there's a strong grapevine, a very strong grapevine. And, but yes, there are people who are isolated and people who are homeless who are isolated and don't know. ASPAN actually has these outreach workers that are out walking under bridges if I see someone that I have never seen before, I've been volunteering with them for 18 years, but if I see someone I haven't ever laid eyes on before who doesn't look connected, I'll call ASPAN and they will send someone to go wherever you tell them you saw someone that might need some help. So they do a lot of community outreach, and the more people like you all who know about all the resources and you can speak, if you see someone that's panhandling, the best thing you can do, I think, and I've been told this by panhandlers myself, that is to tell them about the different resources and to tell them where they might get the clothing they need or a shower or the food, etc., in case they don't know. Again, the grapevine's strong, so many people know and don't prefer to, as Sam, some people just don't choose to or are afraid to live in the shelters.
There's another question. What is Amazon? And I suspect we can expand that out to other large corporations that are headquartered in Arlington. What are they doing to help the safety net?
Yeah, that's really important. They're doing a lot. We are, one of the things, this is not a session about the Community Foundation per se, but we are working very hard to bring the corporate sector in much more substantially into these needs. Arlington, as long as a nonprofit person that's tried to raise funds in Arlington for years, we all lamented in various ways about the fact that Arlington has so many federal government offices and trade associations and think tanks that might be located here, but they don't really claim this as their community. And so in recent years, you know, certainly with Amazon, but Nestle and others, Boeing, we've really tried to work with them in the spirit of this is now your community. And this is, you know, where we hope you will really invest. And of course, you all know, you've seen Amazon has definitely been investing, as have the others. And we just hope to see more and more of that. It definitely, you know, in terms of an economic mandate, even though they may not employ low-income individuals, certainly the ecosystem that they bring their offices into, in terms of wanting their employees to have, you know, various restaurants to go to and places to get coffee and to have childcare and to have a safe place for their relatives to go in terms of care. The larger corporations understand, I hope, that this ecosystem may not be their direct employees, but it's really important to their attracting and keeping employees here.
We have two other questions. They may belong now or they may belong at the end. One asks about if you were going to talk about the project that found a 10-year lifespan disparity between residents in North Arlington and South Arlington.
Well, you will be getting a treat on that with Tricia and Sonia next week. That is the work. I am also a part of that group. It's the Destination 2027 group that has really looked at these disparities and inequities. And a lot of the, basically another name for what I've been talking about today is the expression social determinants of health. So we know, you know, so in the social services sector that health, narrowly defined, is impacted and supported or not by people's housing conditions, their work conditions, their ability to get childcare that's quality and safe, medical access to medical care, and so on. And so those are called the social determinants of health. And Tricia and Sonia will be speaking next week about that 10-year, that decade of difference, that across Arlington conditions are so different that people, there's a decade of difference between life expectancy. I don't want to take away their wonderful, that's what, you'll be hearing more about that.
Okay, there was also a, served up as a philosophical question. Do you think federal, state, local government should be doing more to take on the burden of the nonprofit safety net organizations?
Well, certainly more funding would be called for. When you say take, I think it's important, this nonprofits, and what I hope I've conveyed, they enjoy a trusted space in the lives of people that aren't considered government and that don't raise issues of public charge for people who aren't documented, are afraid that they will be deported because they've accessed resources, or just general, you know, legacies of fear around the government for various populations that we know about. So I would say that if you were saying, should the government take on these roles more, I would say, you know, that balance is important to keep in mind. But certainly the funding is really critical. It's very critical. Did that answer the question?
The person who asked it would have to answer. Perhaps I'll get it in the chat. Let's see, somebody, you know, the answer is yes. And thank you. One last question, or it's about 4 minutes after 1 right now. Do you want to take one more question, or?
Sure.
My wife and I have worked with refugees and the homeless. Many of these clearly have mental health issues that need to be addressed before they can reach a level of stability. What is the best way to get them the help they need?
Yeah, mental health is so important. So as I said earlier, well, the county has, it's called the Behavioral Health Services, and they have a whole spectrum of services for low income individuals, people that are both insured or not. And they even have created a same day access so that if someone's really got, you know, an opportunity to come in and try to seek treatment, they will be seen that day. They have that commitment. There's also a crisis level hotline that the county can respond to in terms of crisis. And then many of these nonprofits have a mental health component. So certainly Doorways for women and children that have kind of trauma or violence, there's a mental health and therapeutic role there. There are Northern Virginia Family Service, I believe has, you know, I know has mental health services, and they work with a lot of refugees. Their office, their Arlington focus, in fact, has been largely around mental health, as well as the early Head Start and Head Start programs. Did I mention Catholic Charities? I think they do some good work with refugees and probably refer them, and the homeless as well, of course.
Okay. Back to you, Anne. No further
Okay.
questions if you want to get back into the presentation.
Sure. So we'll get back to where I was and let me know. Can you see the screen again?
Yes, we can.
So for this last part, I want to tell you of a concerted effort that the nonprofits in the county have made working with us, the foundation, over the past few years to meet the needs that we've been talking about today. In 2016, the Arlington Department of Human Services asked the Community Foundation to lead the nonprofits' work with them to implement the National Bridges Out of Poverty framework. We also have Urban Institute involved in this effort. They have been tremendously helpful in terms of bringing the experiences of other communities in, so we don't have to start from scratch. We learn what others have tried and succeeded in terms of breaking the cycle of poverty, and they've also continued to provide feedback and technical assistance as we work. The ultimate goal of Bridges Out of Poverty is to move beyond just stabilizing people to actually promoting their economic mobility. But first, we had to start by changing the culture of our whole safety net system that serves these folks. We, meaning the county human services folks, the nonprofits, and the foundation, we spent a couple of years having conversation and training to make us more aware of how the realities of poverty clash with systems that are designed by the middle class to serve the middle class. But what does that mean? As you've probably noticed, most bureaucracies are built to serve the convenience of their staff and not their customers. They usually don't respect people's time, and they're not user-friendly in their office hours, forms, menus, phone menus, and systems. To Arlington County's credit, they wanted to break down bureaucratic barriers in the system. They wanted to make whatever changes possible to tease out the bottlenecks and the redundancies that both the nonprofits had, as well as the government in our safety net system. And these bottlenecks and redundancies that are things that waste people's time, and they keep them from getting out of this crisis cycle. So we've all worked together on being less judgmental in our work with people in poverty and to use relationships as a basis for service delivery. One of the first concrete accomplishments that we had in this work was the creation of a common release of information form. It's shared across the county, the schools, the hospital, and the safety net nonprofits. So this is a single form that's HIPAA compliant that allows people to fill out their information and tell their story once. And that information, as long as they sign it and are comfortable, they can release their information across the spectrum of the service providers and on the public and private side. This has been really, really helpful in terms of breaking down barriers and saving people's time. and also sharing information across the safety net so people can work collaboratively with these households. I think we might be the only, if not the only, one of the very few communities that has pulled this off. We found ways to be more flexible. The county and the nonprofits, many of them have extended their office hours and open evenings. This is so that people who are working 2 or 3 jobs and have to take off the day or work hard to find a way to get in can be seen at different hours. We also emphasize what we call warm handoffs. So instead of passing on a phone number and saying, good luck, call these people, we walk them through it. So an example is that when newcomers come into the Arlington Public Schools, either they're new to Arlington or new to this country, and they want to register their children, there's a whole process of paperwork and forms and verifying your income to see if you need free and reduced lunch, and assessing the children to see where they are in terms of grade level, et cetera. And then, as you know, the children have to have physicals and be up to date on their vaccinations. And so if you're new to this community and you don't have a private provider, the county provides those health physicals and vaccinations. And the health department is right across the street from the school's intake center. So as a result of our work in this Bridges Out of Poverty initiative and trying to do reform our safety net system to be more sensitive to people's realities, we now have it set up so that when these households come and spend hours in the school registration center, getting their kids enrolled, they are then walked across the street, and a nurse on the county side of the street is there to do the physical and the vaccinations in one visit that serves dual purposes. We've had about 300 leaders and frontline staff across the whole public-private safety net, meaning, again, the county, the foundation, and the nonprofits that are part of this effort. This is a picture from one of our gatherings. We held very large gatherings with a specialist that we brought in from Minneapolis to train us in this model, and this is one of those occasions. So the hope is that these efforts that we're making are reducing the barriers in navigating the system so people ultimately can meet their potential. In 2018, we decided that we wanted to do a pilot test of these improvements to the system to see if we could help some specific vulnerable families move from crisis to stability to thriving. We call this pilot 200 Bridges, and it's now in its 3rd year. Each household in the pilot has a single point of contact or trusted caseworker from either a nonprofit or Arlington DHS who helps them navigate through the system for all the supports they might need. The caseworkers and the households are supported further with teams of 8 to 10 professionals that have expertise in key domains like housing and health, employment, education, childcare, and so on. So these support teams are people who use their networks from their professional positions and their influence, which they have because they are influential people within the network, to help families work toward their goals, to help them access what they need. This is a 2-gen approach so that we're focusing on both the children and the adults in these households. This is some of our points of contact or navigators. These are the folks that are the single trusted point of contact for the households in 200 Bridges. So now that we're 3 years in and have done some data evaluation, we have seen adults and children in poverty that have improved outcomes across 17 life domains. We're still learning as a community what is and isn't effective. We definitely still hit upon bottlenecks that need work. We are seeing improved use of community resources. So the county and nonprofit staff that are part of this, they use the knowledge and the connections that they make through this model, and they take it out into their work in the broader community. So this pilot with these households has been able to be we take the nuggets and the practices that are developed out into the community so that the whole community can benefit in terms of the resources we develop. And we're also now more informed with data on change that we need around childcare access, employment, housing, living wage challenges, access to healthcare, and so on. For us at the Community Foundation, the experiences of these households and 200 Bridges gives us a continuous feedback loop, and it motivates us to do better for our most vulnerable residents. In the past couple of years, we have set an ambitious group of targets called Shared Prosperity Targets. I just referenced earlier in response to a question, and this is to bring in our corporate partners and our local government and philanthropic donors to scale up what we need in terms of deeply affordable housing, deeply affordable childcare, living wages, and workforce opportunities. So we at the foundation believe that the affordability crisis and the rapid displacement of our low-income residents are the greatest threats to Arlington's long-term health and viability. And it's going to take everyone, including those in this group, not just the nonprofits and government, but also the individuals and businesses to meet these challenges. But without our safety net nonprofits, these residents wouldn't be able to survive. So I'll just leave you with the assurance that any investments in our safety net nonprofits are responsible ones. And I personally, and the Community Foundation as a whole, is proud to work alongside this amazing group of nonprofits. So that's it.
Anne, thank you. Thank you very much. I think we have time for a few more questions, Jeff.
No questions have come in from the chat, but I have a question. So on one of the earlier slides where you listed all of the various categories of needs and then listed some of the organizations that are helping to support those with those needs, there were a lot. There were a lot of needs and there were a lot of organizations. And so how do I, as an individual, decide where am I going to put my volunteer hours? Where am I going to put my donation dollars? Or am I just going to be so overwhelmed by the magnitude of the needs that I'm going to put this aside?
And before you answer that, if I could just mention that the final session we're doing in this series is going to focus on that very question, the time, talent, and treasure discussion. How do you become effective in your volunteering and your giving? But Anne, you probably have a much more direct answer.
Well, no, I think I'm glad you pointed that out because it is a substantive thing to think about and work on. I guess I would just say that people have multiple routes to get at what you're asking, Jeff. Some folks do have specific organizations that they're especially committed to and stick with and stay in touch and informed. And that's certainly, a great way to approach this. Others do explore, do homework, look up organizations on GuideStar and in our local opportunities resource listings. The Community Foundation is another option because we do funnel philanthropic dollars to organizations that fit the needs and preferences of our donors. And then volunteer-wise, the purpose behind Volunteer Arlington, which was set up, which is contracted through the Leadership Center for Excellence, is to help people connect. It's sort of a bulletin board, if you think it that way, of organizations and their needs. And they do a great job of connecting people to volunteer opportunities.
Thank you. That gives me some like an entrance ramp into this, and perhaps for others.
I see the question about Missing Middle Project. Does it target the same groups you target? No. So by missing middle, and I get twisted around this too. Missing middle isn't a group of people. It's a form of housing is what Arlington is talking about. That is sort of the less high density developments, but multifamily, properties or more affordable at that middle range of purchase. It's mostly focused on home ownership. So this is a totally different group that we're talking about, folks that can't afford home ownership and that are way down below what that group would be able to qualify for. So we feel it's very important to shine a light on these lower income individuals and not leave them behind, because they are being left behind. And it's really critical. That's something that we really want to focus on, even though, of course, that entire range of affordability, including missing middle, is also really important to the health and viability of Arlington.
There is another question. Did I understand you to say that Minneapolis has implemented this model and they did the training?
So Bridges Out of Poverty is a national framework, and it's been implemented all over the country. And different communities can take what they learn from it, the research and the tools and the curriculum and the training. We've taken it very seriously and really utilized their resources. So our particular trainer flew in from Minneapolis. She's done a lot of work. That's just her home base, is what I was referencing.
Are there any other questions? Feel free to unmute and ask Anne directly, or you can put them in the chat.
So this is Eileen, and I'm still in shock from the video, how you can earn $60,000 or $80,000 and still being off the cliff. So the accompanying information that you said, it would tell you how much somebody's paying for rent, how much they're paying for food, how much they're paying for childcare, and then what the subsidies are that made her be able to have $287 a month extra versus when she lost a subsidy and all of a sudden.
Yeah, we don't, I'd be happy to share anyone who's specifically interested in those tables and the background modeling, because we do have it. It's not a part of what would normally be sent out because it is so technical. And the basic scenario, it's very real. And I agree. I lost sleep over this, Sandra. I'm like, what's she gonna do? But time and time again, you hear this story. We have so many people in our 200 Bridges pilot that are giving up promotions so that they can not lose these critical benefits. And Arlington is just so out of whack in terms of affordability that's how these numbers play out. But she lives in affordable housing, so her rent is set at 60% AMI, even though she makes less. And I explained to you how that happens. And she qualifies for the child care subsidy, so she gets those for the 2 children. In Arlington, it costs $18,000 to put a 4-year-old in a center and $24,000 to put an infant. And any of you who had that sticker shock can realize that. So her kids are in licensed home daycare, which is the less expensive model. But, many people do underground babysitters. There's ways to work that people are working around this. It's not always as safe, or it's certainly not as high quality as a licensed daycare provider. Lots of households double and triple up to make it work. So yeah, there's a lot of making do going on. But if in her case, and it's actually a conservative scenario, her kids are, she's got the child care. As they get older, she pays for extended day in school. She gets a subsidy for that because of her income, but then she loses it. So yeah, we have the numbers, and I'd be happy to share it with you.
Thanks. It'll take me a while to just comprehend it.
Yeah. We're just a quick little update. We're hoping to launch an unconditional cash pilot in Arlington. And that would be provide monthly income for 18 months for some of our lowest income households to use in whatever way they need the money from 1 month to the next. But before we could do it, we needed to make sure their benefits would be protected. Because again, we would want to harm households by giving them cash.
Yeah, I have to talk in 2 minutes.
So we've been working hard with the state to ensure that those benefits would not be lost with this pilot.
We have no further questions in the chat. We're at about 1:26 right now, so pretty close to the end of the session.
Let me then cause this session to come to a close. I want to thank Anne again for her outstanding presentation. I think you opened a lot of eyes about our community and our community's needs. I think also in the course of talking about all the specific Arlington nonprofits that are engaged in this important work, you've made the point again and again about the nonprofit sector, and when working at its best, it's nimble, it's efficient, it takes risks, and it's trusted. And I think as we move through the next few sessions, I hope people will keep those thoughts in mind, because this third sector is so diverse, and it has been growing, and it's really the question of how, as a society, do we want to sustain it, keep it, and help it fulfill its function. Next week, we'll be talking about philanthropy and community change. And back at the beginning presentation, we learned that earned revenue and government support were two important sources now of revenue for the nonprofit community, but philanthropy is still a strong part of this community. And in philanthropy, we have both individuals and foundations. We've heard today about the Arlington Community Foundation. Next week, we're going to focus on two foundations created in different ways with different purposes that are currently serving the Northern Virginia and I guess in the case of the Meyer Foundation, the larger Washington area community. We're going to look specifically at their decision-making, their priority setting, what sets them apart, what have they done. It's very hard to make charitable investments, and they're going to talk about the process of making those investments and the yield on those investments. And I think Anne mentioned earlier, one of the yields of their investment was the disparity study on health, which we'll learn a lot more about next week. So I thank you all for joining us. I look forward to seeing you all next week. And again, Anne, many thanks for your outstanding presentation.
Thank you very much.